for Medicare. We're going to use it for something else. Under this bill, this 0.5% is now going to be consumed in something outside of Medicare. So no longer do we have a Medicare tax for the Medicare Trust Fund. We have a Medicare tax that funds the Medicare Trust Fund plus other programs. I would say to my colleagues, I think we want a lot of the same things. How we go about it. The senator from Montana recognized the fact that we're going to increase payments to primary care physicians. Ask yourself the question, why only 1 in 50 doctors last year who graduated from medical school is going into primary care? Why do you think that is? Could it be that the government who is setting the payment rates created a maldistribution in remuneration to primary care physicians, therefore they choose to go where they can make 200% more over their lifetime by spending 1 additional year in residency rather than doing primary care? And what this bill does, and what the senator from Arizona is trying to do by sending this bill back, is to refocus us on the fact that Medicare money ought to be used for Medicare. And if, in fact, we're going to slow the growth of Medicare, can we do that without cutting benefits? And to slow the growth in this bill for 11 million Americans who now have Medicare Advantage, you will diminish their benefits. That's out of the $120 billion that's going to come. You can't tell a senior who's in a rural area today, who is on the economic lower rungs of the ladder, who uses Medicare Advantage to equalize their care with somebody who can afford a Medicare supplemental policy, you can't tell them that this is not going to decrease their benefits and decrease their care, because it is. And in the bill, it actually states that it's going to decrease their benefits.
The gentleman, also, very briefly, the senator from Montana talked about the support that it gets. AARP makes more money from Medicap plans than they sell to seniors. AARP should be opposing the bill, but other senior groups like 60 Plus are educating seniors. The AMA endorsement of the bill, shocking. The bill puts the government in charge, but AMA cut a deal to get their Medicare payments addressed by increasing the deficit by $250 billion. And pharma. My God, if there's ever an obscene alliance, the agreement that's been made that would harm seniors because it prohibits, it has the administration against drug reimportation from Canada and competition for treatment of Medicare. So now we understand a little bit better why these special interest groups, 500 and some of them, have visited the White House in recent months, according to White House logs.
The senator would probably be interested to know, and I know my colleagues on the other side, the American Medical Association now represents less than 10% of the actively practicing physicians in this country. The physicians as a whole in this country are adamantly opposed to this bill. And the reason they're opposed to this bill is because you are inserting the government between them and their patient. That's why they're opposed to this bill. So you have the endorsement of the AMA, which represents less than 10% of the practicing doctors, actively practicing doctors in this country, because not only will it increase payments, but CPT code revenue is protected. That's the revenue that this AMA gathers from the payment system that continues to be fostered in this bill, which is their main source of revenue.
Could I ask my colleagues' indulgence for just a moment, because, as you know, the majority leader seems to appear more and more frantic as he perhaps is reading the same polls that we are, that more and more Americans, when they figure out this legislation, are becoming more and more opposed to it. So yesterday, the majority leader came out and directly addressed me, saying, quote, "This man talks about earmarks, but his amendment is one big earmark to the insurance industry." And in addition to that, the sponsor of the amendment, talking about me, during his presidential campaign, talked about cutting these monies. And, you know, Mr. President, I hate to, I say my colleagues, take a trip back down memory lane, but at the time, MoveOn. Oh, and this, of course, was then echoed by DNC spokesperson, who then echoed it throughout the blogosphere and the left-wing liberal blogs. And the fact is that on October 20th, factcheck.org says, quote, he accuses McCain of proposing to cut benefits. Not true. This is from factcheck.org. TV ad and speeches, Obama is making bogus claims that McCain plans to cut $880 billion from Medicare spending and to reduce benefit. A TV spot, a very well-funded campaign, I might add, a TV spot says McCain's plan requires cuts in benefits eligibility or both. Obama said in a speech that McCain plans cuts that would force seniors to pay more for your drugs, receive fewer services, and get lower quality care. Second ad claimed that McCain's plan would bring about a 22% cut in benefits, etc. And the factcheck.org says, quote, these claims are false, based on a single newspaper report that says no such thing. McCain's policy director states unequivocally that no benefit cuts are envisioned. Now, Mr. President, I ask that this entire factcheck.org article be included in the record, and I hope that the senator from Nevada will stop making false claims about repeating the false claims that were in attack ads on me throughout the campaign, funded by tens of millions of dollars, about my positions on health care in America, which the fact checkers found to be totally false. And the narrator says McCain's plan means a 22% cut in benefits. The ad displays a footnote citing an October 6 Wall Street Journal story as its authority. Factcheck.org says, but in fact, the Journal story makes no mention of any 22% reduction or any reduction at all. I hope that, among other things, in his may I describe this frustration, that the Senate Majority Leader would at least not repeat false accusations about what I wanted to do in the presidential campaign. And it's unfortunate. And I hope that maybe, instead of attacking David Broder, instead of attacking me, instead of attacking others who are in support of this amendment, maybe we could have a more meaningful discussion about the facts surrounding this legislation.
To both sides?
30 seconds remaining.
For which side?
For the minority.
For the minority has 30 seconds.
I will speak very quickly since we have 30 seconds. Reality does set in. We have looked at the impact of these cuts on our nursing home beds in Nebraska. We have about 14,000 beds dedicated to Medicare. This will be a loss of $663 per bed. That affects real people. Thank you, Mr. President.
Time has expired.
Let me yield 2 minutes of our time to my distinguished friend and colleague from Nebraska.
Very kind of you, and I appreciate that. Mr. President, maybe it comes from my time as a governor, maybe it comes from my time as a mayor, but somehow, some way, you've got to live with the legislation that is passed, whether it's by the federal government, whether it's at the state level or whatever. You can bounce this back and forth all day, but the reality is these are real cuts, and they involve real programs that involve real people in our states. You can describe them any way you want. You can call them excessive payments. You can do this, that, or the next thing. You can say, well, we're giving this our best shot. But the difficulty is this is a high-risk venture. You are impacting, in my state, for example, and every senator could stand up and give this same speech, you are impacting the most vulnerable population in our nation. People who are in a nursing home who are Medicare beneficiaries. As I said in my short statement, there are 14,061 nursing home beds across our state that are dedicated to Medicare patients. We are working overtime to try to understand what this legislation does.